Do you want fuller looking eyelashes as soon as possible? While there's no overnight solution, if you're willing to put in a few weeks of work, these 6 tips can get you there. Hi everyone, my name's Dr. Saya Nagori. I'm a board certified ophthalmologist. I practice in the state of Maryland and you're watching the iFacts channel. So if you want fuller, better lashes overnight, I'm sorry to disappoint you, but it's not gonna happen overnight unless you're using fake eyelashes, which will actually, with chronic use, make your eyelashes and eyelids worse over time. So today I wanna talk about how you can incorporate things into your daily regimen to have fuller, better looking lashes in 6 to 8 weeks. Number 1, you have to treat any underlying blepharitis. This is going to reduce the inflammation in the area of the eyelashes. But how does this help your eyelashes? Well, it creates a better environment for the eyelashes to grow and not fall out before they're supposed to fall out. We'll get to that in a second. And it also reduces swelling in the lid. So if you're someone who has that upper eyelid fullness, what happens is the eyelashes kind of spread apart because of that fullness. And when you reduce the swelling, it actually helps them to come together with a more fuller appearance. Now, these changes are really subtle because the eye is such a small area. So we're literally talking very small amounts of space, but little things matter when it comes to your eyelashes. Now, also, it's important to mention that most people actually treat their blepharitis incorrectly because they will only use heat, or they will do the treatment in the wrong order, which we're gonna go over in just a second. But first, how do you even know if you have blepharitis that needs to be treated? Well, surveys amongst eye care professionals show that almost 50% of the population has had blepharitis at some point. And treating it is something that you can easily do at home, and it's very safe to do. So you don't necessarily need to wait for a diagnosis. So if you feel like your eyelids are a little bit swollen or fuller than they should be, or you're having any itchy eyelids, you can just start blepharitis treatment. And the proper way to do this is first you want to use a warm compress. I'll link a few products below that I use, but I like to use these microwavable warm compresses because they're easy to use, they're reusable, and until they become visibly soiled, I use them for about a year. Now, of course, if the warm compress that you're using or the heated eye mask that you're using has signs of lots of makeup on it or other things like that, you want to change it out and get a new one. But what you're going to do is you're going to sit with that eye mask on the eyelids for 8 to 10 minutes and also just do a little massage while you have the eye mask on. After you take it off, then you're gonna wanna do a very gentle soapy scrub with warm or lukewarm water and make sure you really get into the area of the eyelashes and eyelids. What happens when people wash their face is they tend to cup their face like that. And what happens is that this entire orbit, if it's deeply sunken back, is not really gonna get access to all that sort of cleansing material that you're using. Why is this so important? Basically, when we use the heat, it expresses the oil from the meibomian glands. There's another video on the channel about meibomian glands. And when that oil comes out, we want to wash it away. We don't want to let it sit there. That's why doing the lukewarm soapy wash after the heat is so important. In an ideal situation, if you have a sty, you're going to want to do this very frequently, maybe 4 to 6 times a day. But if you just have blepharitis, you can do it 1 to 2 times a day, but you need to be consistent and do it almost every day, just like brushing your teeth. Another thing that you can incorporate into treating blepharitis is tea tree oil wipes. And this is because about half of blepharitis cases are actually associated with something called Demodex mites, and tea tree oil wipes can be helpful in getting these under control. There are also some prescription medications that your ophthalmologist can prescribe to you if you really have a bad case of this. But if you are just at home and you want to start the treatment, you can just buy over-the-counter tea tree oil wipe. Okay, so we have blepharitis out of the way. The second tip that you should do or not do is avoid pulling your lashes or even like vigorously rubbing your eyes, especially when you're removing makeup. Now, in an ideal situation, when you're trying to heal the eyelashes and eyelids, you want to take a break from makeup. I know this can be hard as I talk to you with my eyeliner on, so I know it's really hard to take a break from makeup, but I want to explain to you why you should not pull your lashes. So each eyelash goes through 3 phases of growth. There's the anagen phase, which is the growth phase, and this is when the eyelashes are actively growing. Then the second phase is called the catagen phase or the transition phase. This is when the eyelash stops growing, but it's still attached to the eyelid. And then there's the telogen phase or the resting phase, or also the shedding phase. And this is when the eyelash naturally falls out. And this is actually normal. But if you pull your lashes prematurely before they hit this third phase and you don't know what phase they were in, and you pull them during a critical growth phase, it takes them longer to regrow than had they just fallen out naturally. So this is important to not pull the lash. Also, if you continually pull the same lash, it can affect its growth permanently. So the only time an eyelash should be pulled is if it's misdirected, meaning it's going inwards towards the eye and scratching the front part of the eye called the cornea. Now let's get to tip number 3, which is avoid anything that is pro-inflammatory. That means avoid smoking, you want to avoid excessive alcohol use, or any products that can be really harsh on the thin eyelid skin. Again, keeping the eyelids not inflamed is going to help your eyelashes. A good example of this is retinol, because retinol, I use retinol on my skin, but if by accident I happen to get it on my eyelids, it really starts to make my eyelids dry and flaky, and that's because retinol really should not be used on that really thin eyelid skin. Also, if you're prone to eczema and you notice that certain things will flare your eczema, like being in excessive heat or alcohol, then those are things that you want to avoid, because you can also get eczema of the eyelids. In terms of pro-inflammatory things, you're going to also want to avoid any makeup on the eyelid or anything that's going to cause that eyelid to become more inflamed. Now, of course, if you do have to wear makeup for work or a special occasion or a meeting, just make sure to get it off completely and then hydrate your eyelids and eyelashes. That brings us to number 4, which is hydrate the eyelids and eyelashes. Now, in addition to avoiding things that'll dehydrate you, like alcohol, you want to actively hydrate. So just like the hair on your head needs moisture, eyelashes need moisture too. So proper hydration can prevent breakage, and that means they won't break before they're actually supposed to naturally fall off during that resting phase. And then it also promotes growth. Now you can use over-the-counter lash serums to hydrate, or you can also use natural oils. Now castor oil has been talked about a lot, but the truth is it's not gonna actually grow the lash, but it'll promote lash growth by hydrating it and nourishing the lash, so it can support a healthy environment so that your eyelashes don't break. Also, some people say that when they use castor oil, it actually just makes their eyelashes look thicker, so that could be a positive benefit too. Again, you want to balance this with the daily cleansing, because you don't want that castor oil to then clog your meibomian glands and cause blepharitis. Number 5 is one that you've heard before. It's use sunscreen and sunglasses. Obviously, you want to always protect that eyelid from the sun because you don't want it to get sunburned or have any sun damage. And in fact, unprotected sun exposure can not just cause inflammation in that eyelid skin, it can even lead to scary things like eyelid cancer. So definitely you want to incorporate sunscreen, not just during the summer months, but year round. There's UV light everywhere. There's UV light coming through my window right now. So I just have a daily moisturizer that I love. I can link that below as well. It's very nice and thin. It goes on easy. It doesn't feel like you're wearing a lot of sunscreen. And finally, number 6 is seek professional help for severe lash loss. If you're experiencing excessive eyelash shedding, or you feel like there's parts of your eyelids that don't have eyelashes, it's really important to get a doctor involved. There are some medical reasons for experiencing eyelash loss, including things like eyelid cancer, so you definitely want to get that checked out. And then while you wait for your doctor's appointment, you can try the above remedies that I discussed. Now, there are prescription medications that can help with some of the things I discussed before, like eyelid eczema, but these are just things that you can try before you actually head to the eye doctor. Now, this video would not be complete without mentioning a drug called bimatoprost. And how bimatoprost works is it actually extends the growth phase of your eyelashes. You guys have probably seen this on TV or on the internet as Latisse. And so it is proven to actually assist with that growth phase of the eyelash. But again, you need to be patient because nothing is an overnight solution. Even with prescription drugs for eyelash growth, you're gonna have to wait 1 to 2 months to see any results. No matter what method you choose, Consistency is key, and you have to be patient, and definitely get a doctor involved if you're feeling frustrated or you feel like nothing is working. Hope you found this helpful. Remember to hit like and subscribe below, and I'll see you in the next video.